All right, everyone, welcome back to Paging America, where we explore the power, profit, and politics shaping American healthcare and what you can do about it. I'm your host, Miles Baker, along with Dr. Rob Davidson. Dr. Rob, are you still coming to us from New Zealand?
I am, yeah. Just like what do they say, it's been a ripper. This place, yeah, it's a pretty special place. I think I said before, we lived here, we worked here. I worked here in a hospital in a little town with no CAT scan and no surgeon and no OB. That's going back a decade or so. So we kind of coming back to where we were and checking it out again. And yeah, it was really nice. Just to get back to the primary purpose of what we do here, like practicing medicine in a place where people don't have to worry about like, how do I get my prescription filled? Or like if they're having pain, like, I'm okay going to the hospital.
Right.
It was lovely. Like it was hard to come back to the US system where you're doing 52 workarounds to figure out how to get a blood thinner for your fucking patient. So anyway, yeah, I think about that when I'm here, even though like it's for me more of a vacation time.
Yeah.
How's it going back in the States? You guys still in a polar vortex? Do they still call it that? Or is that like so 2020?
This one, it's not a bomb cyclone. It's not a polar vortex.
Okay.
It is cold into your bones. I have one more New Zealand update. Have you visited the Hobbiton?
Oh yeah, we were there 3 days ago.
Did you? Yeah.
Oh yeah.
Rob, you don't know this about me. I am enough of a Tolkien nerd that I went to the Tolkien bench in Oxford last time I was in England, and took a little stroll where he wrote some of his first stuff, and I
got to do a reread because I read him in high school. I read him again like when the movies came out in the early aughts, and then like I feel like it's time. Like the movies, they're amazing. Yeah. So we're gonna be in Wellington and probably checking out some studios, and Weta Studios is the one that Peter Jackson kind of started up with the first Lord of the Rings, and then so it is a cool place, man. Like it's a commitment to get your ass over here, especially time because it's a very uncomfortable flight. But yeah, nice to be out of the winter for a little bit, not to rub it in.
Yeah, that's great. Yeah. All right, everyone, come for the healthcare, stay for the nerding out on Tolkien. So anyway, amen. So Rob, we have a giant show today. Yeah. We're going to be checking back in with Dr. Erin Stevens in Minneapolis, but we're also going to be covering ongoing disruptions, a broader update in the healthcare system by ICE, an update on TrumpRx, as that seems to be bigger and bigger news. ACIP reconsidering all vaccine recommendations, and then a CBS executive being in the Epstein files, CBS Health and sort of head of their health communications, being in the Epstein files, I believe 1,700 times, and what an incredible dirtbag he is. So we got lots to cover. Lots to cover. So I'm going to start off. Why don't we just get right into it? And I think hopefully folks aren't getting sick of the ICE updates, but it is the major thing that is happening, probably not just in Minneapolis, but in the country and the world. So federal agents from ICE and Customs and Border Patrol continue to disrupt delivery of healthcare in Minnesota. AP reports that immigration officers arrived at a Minneapolis hospital with a Mexican immigrant who had broken bones in his face and skull. They claimed that trying to escape, he had, quote, purposefully ran headfirst into a brick wall while handcuffed and in their custody. Staff members at Hennepin County Medical Center determined that they could not possibly account for the fractures and bleeding throughout the 31-year-old's brain, said 3 nurses familiar with the case. It was laughable. If there was something to laugh about, said one of the nurses who spoke to the AP on the condition of anonymity because they were not authorized to discuss patient care. There was no way this person ran headfirst into a wall. At least one ICE officer told caregivers that Castaneda Mondragon got his expletive rocked after his January 8th arrest near a St. Paul shopping center. The court filings at a hospital staff member said, and here's a quote on the topic, I almost think one does not have to be a physician to conclude that a person doesn't get a skull fracture on both the right and left sides of their head and from the front and back by running themselves into a wall. Dr. Lindsay C. Thomas, a board-certified forensic pathologist, told the AP. So you're starting. So we've already talked about how people are missing care or sort of soldiers in hospitals are disrupting care, but now we see sort of the incoming patients, and they're sort of lying about the origins of their injuries. That does that make it harder to treat, Rob? If you're getting sort of a bullshit picture on why someone walks into the ED?
Yeah, I mean, we always learn. I mean, stuff like this, like it's obvious someone's horribly injured. You're going to get CAT scans. You're going to find these injuries. But yeah, like 90% of medicine is history. It really is. Like all the fancy tests, the bells and whistles, 90% of what you do depends upon knowing what transpired leading up to that person getting there. And with trauma, I mean, it is really important to understand, if someone, I mean, we ask people all the time, how far did you fall? If you hit your head, do we need to do these, very invasive, sometimes, often expensive and radiation, all that, do we need to do these tests? And we're better about using those, kind of clinical decision rules to decide those things. That if this person with blood in their head and multiple skull fractures, one would assume is not able to give the most accurate history, like that would go part and parcel with those kinds of injuries. Now you're depending upon, these fucking goons to tell you. Yeah, good on the folks at Hennepin for speaking out, so that this is getting out there. Like, I think that's right. That's with Alex Preddy, with Renee Good, right? The fact that people got those things on camera and we could see with our own eyes what the fuck they're doing. But like to see that, to hear this at least, and hear it from the people who took care of this gentleman, like how fucking horrible, man.
Yeah. It's really frustrating. It should be. I don't exactly know what crime it would be, but it should be a crime for any law enforcement, specifically
assault and battery, right? Assault and battery.
Well, it should be a crime to lie to the hospital about where if they know where the injuries came from and they're just making up some tale. That almost seems like it is like additional injury because you're slowing down the ability to deliver care.
Well, and think about just it doesn't make sense. Intentionally ran into a wall to escape us. Like if you're if you're trying to escape, you're not seeking out the wall,
Yeah. It's such a silly lie. It's you always say these guys don't, when a lot of these folks, and this happens on the right all the time increasingly, that the lie is not to persuade you about the truth of the lie. The lie is just to demonstrate that you have power over someone else and they don't have anything to do. They don't have any recourse.
Yeah.
And so when you come in and you say someone broke their head because they ran themselves into a wall, it's not to convince you that actually happened. It's to show you that they don't have to tell you, right?
So I tell you what, I mean, more and more, I mean, we're getting guidance. I got guidance from, I do some travel medicine locums work. So I have like sort of multiple employers and one of them sent out a big email guidance on how to deal with, if you have immigration and customs folks into your hospital and how important it is. I think ACOG, American College of Obstetricians and Gynecologists, recently put out a statement. I mean, we need more than statements, obviously, but at least to communicate to people on the front lines, like we need to be protecting the folks we are there to protect, right? We need to be providing the care we're there to provide and not allow these folks to get in the way. But it's tough. You're not out there in the world when they're beating the shit out of people and then bringing them in and lying about it. But I think at least, we're seeing folks on the front lines saying, we're not going to just let this stuff happen. We're going to need to make sure that there's a public record of what's going on.
Yeah. Just a few more updates. So the 19th News is reporting that fear of ICE is keeping pregnant immigrants in Minnesota from critical care. That's not, pregnant women who are in need of care. That's not the worst of the worst. Just if we need to underline that anymore, I'm not sure we do, but as another proof point. So pregnant patients increasingly aren't showing up for prenatal visits. Those who are asking if they can have fewer, those who are saying, can I come in less? Some are going without proper nutrition because they're scared to go out to the grocery store. One provider said that in the past 2 months, she's seen multiple cases of a rare complication that often leads to miscarriage after not seeing a patient for months. We've also heard stories of people giving birth at home, which I think we don't have to elaborate too much that is suboptimal and in many cases very dangerous. So
sure can be. Yeah, sure can be. And if it isn't your choice to do that and it's being thrust upon you because you're afraid to go to the place where you normally would get care, like what the fuck? But these guys already demonstrated with the fall of Dobbs and with the extreme abortion bans and people bleeding out in Texas and Georgia, and they don't give a fuck. The policy and the power that they get to exert. And I'm not just talking about the ICE agents. I'm talking about like Stephen Miller and Donald Trump and all these goons who are out there cheering this on and defending these folks and the actions they're taking. Yeah, I don't care if a few people die at home. Yeah.
Yeah. One more update. This is from KFF Health News. Family members and attorneys for patients hospitalized after being detained by federal immigration officials said they are facing extreme difficulty trying to locate those patients and get information about their well-being and provide them emotional and legal support. They say many hospitals refuse to provide information or allow contact with these patients. Instead, hospitals allow immigration officers to call the shots on how much, if any, contact is allowed, some of the attorneys are saying. So it's another instance of like, ICE being bad. We can kind of assume that they're going to have bad behavior. I mean, they're, kidnapping folks and they're not letting people know where they go. But then hospitals, some medical institutions, ACOG mentioned earlier, sort of stepping up, providing guidance, others not being as brave in the face of the circumstances. And it seems like in this case, reporting by KFS suggests that hospitals could find a little bit of a backbone when it comes to treating patients and sharing information.
Yeah, I mean, from your time in the labor world, like collectively, you have a lot more power, right? I mean, we saw this with universities early on, right? If one gets a backbone and stands up, it gives a lot of power. So hopefully, as people see statements from ACOG, I know ASAP, which is the governing body for emergency docs, and others have, it's still statements, but at least in the collective, the statements can give people a little bit of a spine.
Yeah. Well, that's probably a good segue. Speaking of being brave or unbrave, we have a very brave guest, Dr. Erin Stevens, who's an OB-GYN in the Twin Cities. I caught up with her this morning while she was in the active medicine. We had her on the show 2 weeks ago, and we asked her to bring us an update from the Twin Cities, and she was able to give us a couple minutes. So why don't we throw to that right now? All right. We want to welcome back Dr. Erin Stevens. She is an OB-GYN in the Twin Cities in Minnesota. She has been an outspoken advocate about ICE actions in the Minneapolis-St. Paul area, being featured on MS Now's 11th Hour with Stephanie Rule, The Parnas Perspective, The Guardian, and a number of other places. Dr. Erin Stevens, thank you so much for joining us for an update on what's going on in Minnesota, and also for your continued advocacy in all these different outlets to get the word out on what's happening in Minnesota. We're here today. We're just hoping to check back in. Since the last time we talked to you, we talked to a number of doctors from around the Midwest, how the different ways people were preparing, but Minneapolis is in sort of a different phase of this, in which there is potentially a drawdown, but some of it is a little bit murky. So we're just hoping on your perspective on what is happening in this moment, and how's it going there? Yeah.
Yeah, so a drawdown is great. Complete removal would be even better. That's still quite a few agents that are here in our neighborhoods, patrolling outside our schools, places of worship, hospitals, places that people very much need to access. So is it good? Sure, but things could be much better. And there's definitely been this continued uncertainty and fear. And while we're all doing our best to try to respond to that, I think everyone really could be doing better. I know that hospital systems and healthcare organizations have been a little hesitant to speak specifically to the crisis and
Right.
what we would like to see as healthcare workers. And I know many of us would like to see stronger advocacy in that regard.
Yeah, and so specifically from some of the sort of specialty organizations of physicians and nurses, or
Yeah,
and the sort of corporate entities, or
Yeah, some specialties have been stronger than others, and
yeah,
certainly many specialties and organizations have come out and said, all patients need access to healthcare. But some are even hesitant to say that they find that to be a political statement. And I realize it's hard for large organizations to put out broad statements like that. But this is really a time to step up for our patients, step up for our providers, our colleagues, and say, we really can't have ICE in our hospitals. We can't have ICE impeding care, especially for people who are already vulnerable and already experience disparities in healthcare.
that's okay. That's right. I was hoping we could get your reaction to Democrats in Congress. Democrats have issued 10 demands in what they're calling the guardrails that are precondition for DHS funding. One of the guardrails is medical facilities. This is called the Protect Sensitive Locations provision, and it prohibits funds from being used to conduct enforcement near sensitive locations. Those include medical facilities, schools, childcare facilities, churches, polling places, and courts. There's quite a few different guardrails, but this is the one that is impacting the health system and impacting sort of the practice of medicine. I'm wondering if we could get your reaction to the Democrats making that one of their planks.
Yeah, I'm glad that they're coming out and saying that. Those protections used to exist, and the Trump administration got rid of them. So this is
Right.
a system that was already in place, and now everything is very chaotic when it's kind of like ICE agents can be let loose to go wherever they'd like to be. So I love that the Democrats are coming out and saying this. I am sure I can predict exactly what the Republicans are saying in response to that, and that this is not going to go far, but at least taking that stand to say this is what our people in the United States, citizens, immigrants, everyone deserves.
Yeah. And for those who are listening who are medical professionals right now, the Committee to Protect Healthcare is circulating a petition that will be delivered to Congress. Over 2,000 doctors and nurses have signed on, saying we must stick to our guns on prohibiting ICE agents and immigration enforcement, particularly because these folks are soldiers, not necessarily old plainclothes immigration enforcements, but sort of no soldiers in hospitals, and make sure that the sensitive locations provision stays a major plank of any funding of DHS that moves forward.
Yeah, absolutely. And I think everyone needs to continue to understand that ICE agents are different than your average law enforcement agent, both in their training and what their goals and expectations are. And so we can't just treat them exactly the same and go by existing policies for law enforcement and hospitals.
Right. That's exactly right. Okay, great. Okay. And then I have to check in while we have you. How are folks holding up? I know that sort of I would almost say the intensity of activism or the intensity of organizing that we see out of Minneapolis is something people have likened it to sort of the probably the largest civil disobedience since the civil rights movement in the United States of America. How are people holding up? How are your colleagues holding up? How are your fellow sort of organizer types holding up? What's it like on the ground?
Yeah, I think it's still that balance of fear and hope, getting a little overwhelmed with everything that's going on, but continuing to fight regardless and hoping we can find time to care for ourselves throughout all of that. But the spirit of the Twin Cities is still here, that people are rising up and helping their community members. And I hope that persists after the ICE surge is over, because what is happening right now is just an exacerbated version of what is the everyday reality for many people in this country. And we need to continue to show up as allies and neighbors and support people.
That's great. Okay, Dr. Erin Stevens, I know you are in the act of medicine. And so thank you so much for taking a couple of minutes to give everyone an update on your perspective in Minneapolis. We appreciate it. We'll maybe ask you again if sort of the siege of Minneapolis continues. So
absolutely happy to talk anytime.
Okay, thank you, Dr. Stevens.
Thanks.
Okay, we're back. Thanks again for Dr. Erin Stevens. Great update, and we wish everyone who's fighting the good fight up there well. And yeah, forward to
she's awesome. Yeah, we're proud to have her. To come on here and give us updates as a member of the Committee to Protect Healthcare. And just a fierce advocate for her patients. Love it.
Yeah, that's great. All right, let's move on to topics beyond ICE. We have the Democratic senators are saying Trump's TrumpRx website may not be legal. If you haven't visited TrumpRx website, please visit it and see that they have a bananas aesthetic. It's the only thing I get. It's not a government website. It's a shopping mall. It's like, I don't know what it is. And it's not like totally built out just yet, but it's clear people are trying to make money. So in a letter to an HHS watchdog group, Senators Dick Durbin, Peter Welch, and Elizabeth Warren said, given that oversight request from Congress for information about the scope, structure, and legal authority underpinning the TrumpRx website have gone unanswered by HHS, and due to the lack of clarity about how HHS Office of Inspector General will conduct oversight of a manufacturer's direct-to-consumer platform that is embedded in the TrumpRx website. We cannot be sure that TrumpRx will comply with existing federal law. Via Stat News, legitimate concerns about inappropriate prescribing, conflicts of interest, and inadequate care have been raised about the exact types of DTC platforms to which TrumpRx would route patients, DTC being direct-to-consumer. The senators wrote in their letter. We had talked about this on this show, but TrumpRx continues to be a complete black box. Yeah. There's like a lot of hype around it without any specifics. The specifics are few and far between, but it does seem like there is a worry that there'll be third-party. Of course there is. Third-party profit makers. And then just finally, via Pharma Voice, this is a trade publication that seems to have independent reporting embedded inside of it. In many cases, the discounted prices offered through these websites are more than a patient would pay if they want to go through insurance. As a result, the program may only benefit uninsured Americans, which is about 8% of the country, those with high deductibles, or patients with insurance that doesn't cover a specific drug. In addition, pharma companies have already raised prices on many TrumpRx listed drugs this year. There appears to be a possible conflict of interest involved in the potential relationship between TrumpRx and an online dispensing company, BlinkRx, on whose board the president's son, Donald Trump Jr., has sat since February 2025. Sure seems like this is not a project to lower prescription drug costs across the board, and possibly yet another profit venture for the Trump family. I don't know. What is your thoughts, Rob?
I mean, could this be the least surprising thing about TrumpRx? That Don Jr. sits on a board of a company that they may be benefiting. Right. Yeah. If you look at, kind of digging into the letter from Warren, Welch, and Durbin, they talked about how, these companies basically have this vertical where they'll partner with online like telehealth type of platform, and they did doing some research. They said in one instance when people went to this telehealth platform, 100% of the patients who visited with these telehealth providers ended up getting prescriptions from the company that was partnered with the telehealth provider. It's it's like if providers are part of this, like it's offensive, to be a healthcare provider to know this happened. But we know, there's grift all in every field, obviously. But yeah, it's a shame because high prescription drug costs are really a critical thing in people's lives, right? Like we've been on the fighting end of getting prescription drug boards in states, to try to get, and to successfully now start getting prices to come down. And then this guy comes along with a big glossy website. And what is the front page is like him sitting in the Oval Office, with the kind of the typical, Jesus. And to kind of finally realize this is all a bunch of bullshit. It appears to be, right? It appears to be something to get money into some people who he wants to, including his son. I don't know, man. Wonder,
I envision, I don't know if this happened or not, but in my mind, they're all sitting around in a circle and someone's like, well, which one of the Trump family members are going to take the drug scam? And everyone looks at Don Jr. He clears his sinuses and they're like, I'll do it.
Yeah.
And we're like, all right, Don Jr. will take the drug scam. Perfect. Okay.
Yeah. Little too much there. Too on the nose. Jesus.
A little too on the nose. Yeah. The site launches at 7 p.m. 7 p.m. today, according to the countdown clock on the site. So while we're recording this, we don't know what's going to totally be on the site. Maybe we'll be totally wrong. We suspect we won't be. But you'll be able to check it out if you listen to this this evening. If you're on checkout, but do check out the website before it goes live, because it is bananas. We'll see and we'll come back with updates on what we find. So, all right. ACIP is reconsidering all vaccine recommendations, the sum of all fears. I think there was this thought that obviously among senators, there was a thought that Kennedy wouldn't pursue his most aggressive anti-vaccine policies. And, there was a thought that maybe it won't be as bad as it obviously was going to be. And I think we are I think it's worse. Honestly, it's a little worse than I thought it could possibly be. But so the Guardian reports that the Advisory Committee on Immunization Practices, ACIP, is now reconsidering all vaccine recommendations across the board. So all vaccine recommendations are being reconsidered by U.S. Vaccines Committee ACIP, according to the top advisor, who in recent interviews slammed vaccination requirements for attending school and said vaccines should be taken on the advice of an individual's doctor. Significant additional changes may be made to the childhood immunization schedule. Ellen told the New York Times last week, ACIP may not necessarily change the recommendations for all vaccines to become optional, but the committee is reevaluating all of the vaccines products, including risks and benefits. Millen has previously said he supported individuals over the collective public and framed vaccine debates as autonomy versus public health. We also had reports that Kennedy had said that ACIP should focus on harms, not efficacy. So
jeez, yeah. I think I saw a report. I saw reporting in Stat News on Ralph Norman. I think you talked about him extensively on an episode with a reporter from Louisiana. He's the guy's the deputy at the CDC, and he talking about measles outbreaks. Said, well, it's just the cost of doing business, right? Because of international travel. It's like they're talking about losing measles elimination status. He said, well, it's the cost of doing business. We got international travel. I was
just reading about this. We're very close to losing it.
Very close. Status, and the reality is, there's an outbreak in California, I think, Disneyland, from an international traveler, right? The benefit of having herd immunity in a country, in a state, in a community, in a country, is that when there is a case that comes in, you can put it out, right? You can put out the fire. Yeah. And because of RFK Jr.'s, decades-long advocacy against vaccination, particularly MMR, in part, like that adds to the fact that we can't put out the fires, right? You get sustained transmission ripping through communities because you have, I think talk about schools where, 60%, 70%, 80%, which just isn't enough, right? You need that 95, 90% plus with things like measles that are so like, for them to just say, well, cost of doing business. I mean, it's like Dr. Oz, talking about, well, everything about his views on health is just so people can work longer and be more productive and contribute to the GDP. Like anyway.
The over 600 people in South Carolina who've gotten measles are probably not contributing to GDP.
Yeah, right.
I was reading about like the cases of encephalitis that end up happening too in South Carolina. It's just really dark, and it's a lot of children, and it's just really sad.
Yeah, it's like a bad disease. That's why we wanted to eliminate it, right?
To get rid of it, right?
That's why we have science. Jesus.
Right. Now, the changeover of ACIP, we talk about on this show about how Robert Kennedy is using basically the government for coalition management. We're no longer doing science out of the parts of the CDC. Some parts of the CDC, it sounds like, still actually provide technical support, like to local health departments. Like it hasn't like totally broken down into all the pieces of the CDC, but the pieces that Bobby Kennedy has totally refashioned, that is for a project of politics and coalition management, as opposed to the project anywhere near public health, right? It's all public messaging work. And so this idea that you're going to take ACIP, which performed a pretty important function in
and an independent function, right?
An independent function
of the agency,
right,
critically important.
Is now a mouthpiece for vaccine risk, whether there's data or not, and there isn't. If that it's a mouthpiece for vaccine risk is like sort of the completion of the transformation of that piece of critical public health infrastructure into a propaganda outfit.
Yeah. And we've talked about it, right? Like MAHA and sort of the wellness, online wellness community, they're not natural fits for sort of Donald Trump and MAGA. Like it doesn't, but that is part of the coalition that allowed him to win in 2024. And so like, I think keeping those folks on board when a lot of the other shit they're doing, with big agriculture and, and the environment and healthcare in general, perhaps don't align with this crowd, like they're getting theirs in ACIP and in RFK when it comes to vaccines, like that. It feels like is such an important issue for those folks. It's a way to keep a lot of them engaged, even though the rest of MAGA is just fucking falling apart.
Yeah,
and kids are the primary victims of this.
That's right. And it'll be interesting to. It's also what sucks about it too is because if you're in New York or Chicago or San Francisco, if you're in like one of these cities with robust health systems and you are a person of modest to more means, your kids probably aren't going to be terribly affected. Like there will be wealthy enclaves inside cities that retain herd immunity because there are just like not that many people who are susceptible to this type of propaganda, and like people are going to protect their kids. And it's like not only just going to fall on kids, it's going to be fall on like kids of like working class people who are really going to get just absolutely screwed. And in the American South, where like you get like the governments of Mississippi or Louisiana or South Carolina, who just have no Florida in particular, where the state government has no interest in backfilling any of the loss that we're experiencing at the national, public health infrastructure.
It is bizarre. Like they're going after their base. They're going after
just totally going after their own base. Yeah. It's too bad.
Yeah.
Okay. This is, I want to say this is the fun one. This is the fun story, but it's not fun. It's creepy.
It's not fun.
It's not. I mean, there's some like, I don't know if it's prurient. I don't know what it is, but it's just like, because it like hurt, because it's like so obvious hypocrisy that there's like a little bit of like, we told you so, but it's like the least fun we told you so ever when it comes to the Epstein stuff. So more Epstein files released. Trump says it absolves him. New CBS Health contributor. I think I said he was an executive before. He's a contributor. Sorry. New CBS Health contributor mentioned hundreds of times in the Epstein files. And just be clear, it doesn't absolve Trump. So we're just noting that he said it absolved him. Yeah. Donald Trump is in the Epstein files. I think everyone knows this, like more than anyone else almost.
Right.
And then, but the CBS Health contributor was mentioned hundreds of times and had some of the absolute grossest emails. Just a dirtbag. Anyway, massive tranche of material from the Epstein files was released last Friday, and they included some shocking revelations. Trump, who is mentioned over 3,000 times in the files, claimed they absolve him. It was told by some very important people that not only does it absolve me, it's the opposite of what people were hoping. The radical left. Trump told reporters in his first public comments, I think it's real. This is more Trump. I think it's really time for the country to get into something else. Trump told reporters in the Oval Office on Tuesday, now that nothing came out about me other than it was a conspiracy against me, literally by Epstein and other people. One of the people mentioned more than 1,700 times, sorry, we said hundreds earlier, 1,700 times in the files is wellness and longevity influencer, Dr. Peter Attia. Attia published a lengthy apology on X in which he claims he never saw any underage girls with Epstein, never witnessed any criminal activity, and basically knew nothing about the sordid criminal life of the man he told Epstein's assistant that he goes withdrawal when I don't see him. We're not going to read any of his other emails because they're gross.
Don't even look him up if you want. I'm sad that gross. I did. Yeah. I'm sad that I looked him up.
I'm sad that I did too. So this guy's like he's like the sticky glue between Maha and like the biohackers in Silicon Valley. Like he's like the bridge. The bridge character between those two sort of camps of strangeness. And he has this incredibly popular podcast. He's a Stanford trained physician, but he dropped out of surgical residency, which this is did
it's
Casey
a trend
Means?
line. Got a trend line, right?
Yeah. Casey Means did this? Same thing. Okay. She did the exact same thing. All right. It's just all these influencers like attempt medical school and like find a different way to make money, I guess, and then go trick people. Right. So he spent a few years working in management consulting before opening his own clinical practice in 2014. He became really prominent when he sold a book called Outlive: The Science of Longevity. Wall Street Journal has called him the favorite doctor of biohackers. But just last week, he was announced as a CBS News as a health contributor. And then like shortly thereafter, these disgusting, insane emails come out where he was just like absolutely chummy with Jeffrey Epstein and talking about all this lurid shit. It's strange. Whatever you want, Rob, I'd love your thoughts on any of it. I think specifically like having a major broadcaster like CBS have a quack like this in their midst is a real shame for the country.
Yeah, I mean, Barry Weiss, right, took over CBS, their news side, and someone like Dr. Attia. Again, we just got to go back, like just like Casey means, it's fine. You go to med school. Med school is hard, right? Residency was hard. Like especially surgical residency. Like typically, it's every single like your schedule is 12 hours on, 12 hours off, 36 hours on, 12 hours off, 12 hours on for like 5 years, and you get a couple weeks vacation. That's how it was when we were going through, and that's
being a dad.
It's yeah, but and so I get that you might be a few years into that and say, fuck, this isn't good. I mean, most certain surgical residents should tell you this. By the time they get to their 4th, 5th year, most of them are real assholes because you're just chronically fatigued and sleep deprived. And so I get how after a few years of that, you say, I don't think I want to do this. And so I'm going to go make money doing something else. Right. And it's really a shame that these folks then go off and grift off of kind of the wellness space. And I don't know. I have not read extensively into Dr. Attia's, on his website or listened to his podcast, but it's, like Casey means, right? These folks are making just gobs of money, writing books, doing podcasts, having this influence over this crowd. But then for like CBS to bring him in as like a health contributor, I don't know, like what are his credentials? His credentials are having started a successful business in wellness. Like, how does that make you anything? I don't know.
So it just, this is reported, in 60 Minutes. He said that he charges around $100,000 a year for his concierge practice as like the doctor to the biohackers. I would just like to say that in a free country, I think if wealthy people want to experiment on themselves with fringy medicine, like go for it. If you do it, no one's trying to stop. That's fine. If you want to like do the weirdest things to yourselves, do the weirdest things to yourselves. But like, don't put this kook on CBS where like his nonsense. Bill Clinton has this great quote where what we say on television falls on the serious and the delirious alike. And so when you take a broadcaster like CBS and you have things that are nonsense or silly or possibly dangerous, falling, being communicated out from not credible sources, which I think after the Epstein stuff, Attia is like, not a credible source.
Yeah.
That's actually something you ought not to do, and we maybe shouldn't let you do that. Like that's not cancel culture. That's not freedom of speech. That's using the broadcast network to pump out nonsense and grift off people. So,
I mean, and with someone like Casey Beans now, they're trying to put that person in an actual position within the government, right, on a government salary. And I'm not claiming she's in the Epstein file. I'm not claiming anything like that, but like her side hustle, her main hustle of wellness and selling glucose monitors to people without diabetes, and I think her company made $23 million in 23 or 24, and like all of that, putting Dr. Oz as head of CMS, now he had a respectable career, we hear, right? That's what's reported in cardiothoracic surgery, but then has done an about face and kind of pimped himself out to sell products on a TV show and online, to sell private Medicare insurance and then oversee Medicare. Like, Jesus, so beyond like CBS, I mean, that's pretty egregious that a company using the public airwaves to inform the public supposedly would bring on someone like this as a health contributor. But our fucking government, just with means and odds.
It's sort of It's sort of like at the individual level, like I don't like it, but like I guess like you're allowed. And then on the airways level, I really don't like it. I don't think you should be allowed. And then on especially if it's like pernicious, like intentional profiteering that can cause damage to people. And then at the government, like these folks should be nowhere near the government. And the fact that they're all kind of like in this stew where the government and the broadcaster are getting closer and closer, and the CBS is slowly transforming into something closer to state television than what it previously was. That's very troubling. It's very, very troubling. And,
it is very troubling. And I agree with you. Like if people want to do this on their own, that's fine. I mean, I've seen patients who go, and I think it goes back to, we shared some of that Noah Wiley video with the probiotics and the antibiotics get you the perfect level of biotics, you know, like Jesus. I mean, I take a multivitamin, most days, some days, I don't know. Like, sure, I don't know if it helps, you know, I'd probably pee most of it out, whatever, you know, I'm not going to hurt anything. But some of the shit these guys are pushing, like, I don't know. I mean, this was the horse pace crowd, right? This was that we, you know, there's a lot of overlap. The Venn diagram of Dr. Attia listeners and folks taking hydroxychloroquine or folks taking ivermectin during COVID and not getting the vaccine has to be pretty significant, you know. I don't know that the data's out there, and I don't even want to see it. But one has to imagine.
Yeah, and if you want to, rich people want to tinker on themselves, I just gonna say, like, go for it, do your thing. Just don't steal the television or the government to promote it to other people, because it's
just like with vaccines, right? If you want to make the personal decision not to get yourself or your child vaccinated, I guess, okay, you know, but then
you and I disagree about this.
Oh yeah, but don't let it bleed then into the official public policy of the actual government and the health apparatus of the government. I mean, dear God, hopefully we can all agree that that is way too far. And we can quibble about like to what level of personal freedom one should get, right? Maybe it's like, hey, cool, just don't hang out in my kid's classroom. You know, great.
That's right. That's it. You know, as a person who lives in the city of Chicago and is above the Mason-Dixon line, I am like extremely disinterested in sending my child to public school with other unvaccinated children. But you know, I get that there's more of a debate there than there is using the airways to promote biohacking.
Jesus. Yeah. Well,
anyway,
apparently Dr. Attia is having a week.
Yeah. Well, Dr. Attia, we wish you well as you continue to disgust the entire country with your behavior. We hope Barry Weiss makes a choice. By the way, Barry Weiss has said she's resisted dropping Attia, citing concerns about cancel culture. So she's like, on one hand, you have 1,700 emails with America's most notorious pedophile, and on the other hand, you have cancel culture, and she's coming down hard on cancel culture. Good judgment on that one, Barry Weiss. No.
Both sides, Miles.
Both sides. So anyway, I don't know, Rob. That maybe that does it for today. Do you have anything else you want to chat about before we go?
No, I think we just got to keep an eye on all of it, and particularly TrumpRx. Like as that is sort of unfolding before our eyes, we've anticipated this. It was supposed to come out at the end of January, then it bumped it a week. I'm surprised it wasn't. We'll tell you in 2 weeks, and maybe that will be what comes to pass once it gets unfurled. But I don't know. The least surprising thing is that these guys are profiting off of something supposedly there to help people, you know, afford health care. And so I guess we'll just keep an eye on that. That's part of our job these days, apparently. Not the most fun part of our jobs on a daily basis. Right. But I think it's important. So we'll keep an eye on it.
All right. So stick around right here. We'll be bringing you more about TrumpRx and the unfolding potential profiteering from the administration around pharmaceuticals. With that, I'm going to read us out. Today's episode was written by Chris Savage, Dr. Rob Davidson, and me, Miles Baker. It was produced by Amelia Dillenschneider, Joel Bryson, and Chris Savage. It was edited by Darian Badigan. Our music is by Annette Somerset at Duneflower Productions. If you enjoyed today's show, please subscribe and leave us a rating on YouTube, Spotify, Apple Podcasts, or wherever you listen. You can also follow us on Paging America on Substack. And if you want to support this work and become a paying subscriber, we would appreciate it. Physicians, your voice matters. Join the fight for better American healthcare by becoming a member of the Committee to Protect Healthcare. Visit www.committee-to-protect to learn more. And before we go, just another thank you to Dr. Erin Stevens for bringing us the update from Minnesota. Dr. Rob, I hope you continue to have a great trip. And
all right.
I'll talk to you the next time.
See you soon. Bye.